Welcome to the CHCI Fall Health Summit panel, The State of Latina Health. We are grateful to our sponsors, Exogen, Planned Parenthood Federation of America, and Univision Communications. Our panel host for today will be Congresswoman Linda Sanchez, representing California's 38th Congressional District. Elected to Congress in 2002, Sanchez is the first Latina to serve on the House Committee on Ways and Means and the House Judiciary Committee. She co-founded the Congressional Labor and Working Families Caucus and has served in several leadership positions, including the House Ethics Committee, the Congressional Hispanic Caucus, and the House Democratic Caucus. Welcome remarks will be provided by Mariela Romero, Director of Regional Community Empowerment at Univision Communications and producer of the award-winning regional news magazine Conexión Fin de Semana. Our moderator for today's panel is Janet Alvarez, contributor to CNBC and Telemundo, and executive editor of Wisebread. Please welcome our opening remarks speaker, Congresswoman Linda Sanchez, followed by Mariela Romero.
Good afternoon, everyone. I'm Congresswoman Linda Sanchez, and I proudly represent California's 38th District in Congress. First, I'd like to thank CHCI for inviting me today. As the only Latina and a senior member on the Ways and Means Committee, which has jurisdiction over healthcare issues, it's an honor to kick off this discussion. Let me start by saying that I believe that healthcare is a right. I believe everyone should have access to affordable, high-quality healthcare, no matter who they are or their ability to pay. We made great strides more than a decade ago with the passage of the Affordable Care Act. I was proud to help champion a provision that puts a stop to health insurance plans charging more based on gender. Yet Latinas still have some of the highest uninsured rates in America, and we often face significant mental, reproductive, and other health issues at a disproportionate rate. That's why conversations like the one we're having today are so important. They help us come together to build on our efforts to expand access to health coverage and culturally competent care. But we also need to resolve the issues that affect the overall well-being of Latinas in America. Many people don't realize how things like education, housing, and immigration status all have adverse effects on the health of our communities. For example, one study from UCLA found that before the pandemic, the number of Latinas in the U.S. labor force was projected to grow by more than 25% between 2019 and 2029. But that same report also found that from March 2020 to March 2021, the number of Latinas in the workforce dropped by almost 3%. That's the biggest drop in labor force size of any demographic group. This just proves what we've known all along. Latinas play a key role in our society and our economy. And it's just one more reason to expand access to resources like healthcare, childcare, and caregiving. As the daughter of immigrants and a proud Latina myself, I'm proud to fight for our community every day in Congress, and I won't stop until every Latina can access the care she needs and deserves. Thank you again to CHCI for putting this panel together during this timely and much-needed health summit. And thank you to all of our participants for joining us. Let's get started.
Good afternoon. I am honored to welcome you to the Congressional Hispanic Caucus Institute's breakout session on the state of Latina health. Univision is a proud sponsor of this important summit to talk about a wide range of health-related issues affecting our community. During the COVID-19 pandemic, our community has faced some of the most damaging health and economic effects, which often go hand in hand. Latinos are twice as likely to be infected and nearly 3 times more likely to die from this virus. Univision's multi-platform Unidos por los Nuestros campaign has offered critical resources related to COVID prevention and vaccine awareness and combating disinformation and misinformation. The campaign features a series of town halls with medical experts and community leaders, a bilingual national hotline with personalized assistance signing up for vaccines, an online vaccine finder providing locations based on zip code, and a digital campaign with our chief medical correspondent, Dr. Juan Rivera. And to speak to mental health challenges, Univision hosted a virtual discussion in partnership with the National Alliance of Mental Illness, focusing on issues within our community. Given the complex issues facing us, conversations like this are crucial to explore how we can improve health disparities and ensure more equitable care for Latinas. On behalf of the Univision Familia, I thank you all for your talent and hard work to advance our community.
We're joined today to discuss a crucial issue in our community, and that is the state of Latina health. And you can follow us on Twitter with the hashtag CHCI Summit. We appreciate your support in amplifying our voice on this critical issue. I'll briefly introduce our panelists now. First, we'll start with Bernice Nunez Constant of Ultimate Health Services.
Hi, good morning, everyone, or good afternoon. Bernice Nunez Constant, proud alum of the CHCI program, class of 2011. It's my pleasure to be with you all this morning. I serve as the Vice President of Government Affairs and Civic Engagement for Ultimate Health Services, one of the nation's largest federally qualified health centers, and have had the privilege of serving the front line and our most hardest hit communities over the pandemic and throughout my career.
Thank you, Bernice. Our next panelist, Ymelsi Rodriguez, President and CEO of Planned Parenthood for the St. Louis region and Southwest Missouri.
Buenas tardes, and thank you to CHCI for including me in this important conversation. I am a Puerto Rican native. I was starting to become an industrial engineer when I started volunteering as a Spanish-speaking language translator in Planned Parenthood. Through that work and through my own lived experiences, I went into health services with a focus on operations, wanting to ensure patient-centered workflows in all clinical settings. Today, I am the president and CEO of Planned Parenthood of the St. Louis region in Southwest Missouri, which operates 9 health centers in Missouri and in Southern Illinois. We provide sexual and reproductive health care to many rural communities where there are some of the highest percentages of Hispanic and Latino populations in our states. I am so grateful for spaces like this where we can share information and thought partnership to improve the lives of our communities, especially in places where Latino people live in isolation and can be further marginalized in those environments. Thank you again for the opportunity of joining you this morning.
Thank you, Ymelsi. Our next distinguished panelist today is Debra Zack, MD, PhD, Chief Medical Officer at Exogen.
Hello, everyone. Pleased to be joining this. We thank the CHCI for providing a forum that we can discuss this disparity in healthcare for Latina women, which is often so overlooked. We're deeply passionate about this issue as we serve the rheumatology community with novel diagnostic and monitoring solutions for those with rheumatic disease. 90% of lupus patients are women, and in women of color, both Hispanic and Black, it's 2 to 3 times more prevalent, develops at a younger age with more serious complications, higher organ loss, pregnancy complications, and higher death rates than in other ethnicities. It also tends to affect young women at exactly the time when you're striving to develop careers, start families, and often has devastating consequences. It starts with symptoms that are easily confused with other diseases, and Lupus Foundation says it can take up to 6 years to diagnose while damage can accumulate. So early diagnosis and treatment are key, and we're passionate about bringing these solutions to Latina women everywhere.
Thank you, Dr. Zack. And our final distinguished panelist today is Lillian German, Director of Government Affairs, Ferring Pharmaceuticals.
Thank you, Janet, and thank you to CHCI. This is such a distinguished panel. I am so honored. I had the great privilege of working with Congresswoman Linda Sanchez on the House Judiciary Committee for 9 years. I was a civil rights counsel, and she chaired the subcommittee on regulatory reform. And we had many discussions around this very issue, back in the day. And so I am just so excited and proud and, just honored to be here to represent my company, Ferring Pharmaceuticals, for our 70-year history in reproductive medicine and women's health. And that is something that I am passionate about. And I still get to be a civil rights leader or civil rights servant even though I work for a pharmaceutical company. So I'm very proud to be here, and I cannot wait to jump into this conversation, this important conversation.
Thank you all for joining us again. My first question will be directed to each of you. We'll start with Bernice Nunez. Bernice, given your role in your organization, what do you feel is the greatest impact on Latina health today?
So I think primarily we need to address, we are obviously still in this pandemic, and there has been major losses as it relates to Latinas exiting the workforce, as mentioned in Congresswoman Linda Sanchez's opening remarks. And so these losses represent decades of advances in terms of just women's rights and Latinas making gains in the workforce. In addition, Latinas have also bared the brunt of the burden as it relates to family responsibilities and child caregiving, for example, and therefore many of them really had to leave the workforce because it was, they found themselves in hospitality and leisure type of jobs, and they really kind of did the math, and it did not make sense for them to continue in the workforce, and really chose to stay home and care for their children and not put them at risk during a once in a lifetime pandemic here. And so I would say that just to summarize, that we've lost major gains that we've made in terms of the workforce. And by that, leaving the workforce, obviously we also lose benefits and coverage options that we depend on primarily through our employers.
Thank you, Bernice. I'll direct the same question now to Ymelsi Rodriguez. Ymelsi, given your role in your organization, what do you feel is the greatest impact to Latino health in the United States today?
Thank you for your question. Without a doubt, this year has been the worst for just legislative attacks on reproductive rights and reproductive freedoms, specifically around abortion, since the 1973 Roe versus Wade decision, with more than 100 state abortion restrictions enacted into law, including, as many of you have heard, the unconstitutional Texas abortion ban, which we know that abortion bans specifically and particularly disproportionately affect people of color, including Latinas, people with low incomes, and those that have traditionally been most marginalized and oppressed. So I think it's really important, as we're having this conversation today, that we understand that we cannot continue to be complacent, that we have no more time to waste hoping that the courts will protect the health and rights of all women, including Latina women, and that abortion hangs by a thread right now. So as we continue our conversation today, let's make sure that we continue to advocate for the Senate to take up and pass the Women's Health Protection Act as soon as possible. And let's continue our advocacy and raising our voices as Latinas around this country to make sure that lawmakers at every level of government ensure that everyone can make their own healthcare decisions without any political interference, because that's how we're going to be able to achieve reproductive freedom, justice, and health equity for all, but specifically for Latinas in this country.
Thank you, Ymelsi. And Dr. Debra Zack, I'd now like to direct the same question to you. Based on your role in your organization, what do you think is the greatest impact on Latina health in the United States today?
I think without a doubt, access to healthcare and to appropriate diagnosis and treatment when folks are ill is of utmost importance. I've worked at county hospitals in the past, and it's just striking how much better utilized our health dollars could be if we used them more efficiently, so that all could have appropriate health care when they need it and don't have to wait and let disease get worse and organs be damaged and families destroyed because young women can't take care of their families if they're ill. So really access, early diagnosis, appropriate utilization of healthcare is, in my world, extremely important.
Thank you, Dr. Zack. And Lillian German, I'd like to afford you the same opportunity. Based on your role in your organization, what do you think is the greatest impact on Latina health in the US today?
So I would certainly echo the comments of Deborah, Ymelsi, and Bernice. Absolutely. And I would especially give praise to Ymelsi for the work that she's doing. This law, this unconstitutional abortion ban passed in Texas, affected work that I'm doing around fertility preservation. I'll speak to the issue of infertility and treatments later, but I was working in Texas with the legislature to try to pass a bill that would, or a law rather, that would give those individuals who have health insurance and who are on Medicaid the opportunity to preserve their eggs and sperm prior to cancer treatment. And in Texas, 3,000 young Latinas will be diagnosed with cancer this year. And so we were fighting for their right, those who have insurance and those who are on Medicaid, to be able to preserve their eggs and sperm. Well, because this law, or that bill at the time, that unconstitutional ban on abortion, Ymelsi, was moving, I kept getting the question from Republican lawmakers who had in previous years supported us. They said, well, what about embryos? And I said, you know what, if we got to get rid of embryos, we'll get rid of embryos. Okay. So in that case, you're talking about, men and women who want to take their eggs and sperm, create an embryo and then preserve that. And it costs $8,000 to do that. So you want me to just say to this couple, a married couple or a couple, you can only do your eggs or sperm. Okay, if that's the best we can get, we'll get it. Well, at the ninth hour, we're told, you know what, this is really going to cause a problem for us because we've got to pass this bill. And they did, and they threw us away. So that's 3,000 Latinas who will be forced to come up with $8,000 to cover their eggs just to be able, the cancer won't kill them. They'll be cured of cancer. They'll go on to live productive lives, but they won't be able to be a parent. So I would say ignorance. I would say a lack of care for our communities. I would say, states like California are expanding Medicaid coverage. States like Texas refuse to, all those things are so critical and are hurting us. And I would certainly add, just ignorance on the part of so many.
Bernice, I'd like to direct the next question to you. One study found that close to 700,000 Latinas lost their jobs as a result of COVID across our country. With respect to health and health care, how has COVID specifically impacted the Latina community?
Sure. Thank you for that question. And so, like I briefly mentioned, just kind of in the opening question, this mass exodus that Latinas have had to, make from the workforce really has impacted just coverage options available, right? So a lot of us rely on our employers for our health insurance and our benefits, and therefore we leave the workforce and we potentially lose that coverage option. So that's number one. Like Lillian just mentioned as well, states are very across the board on the state of their Medicaid system, what services are covered, the access points that folks have for the needed services that they require. And so here in California, we've made major gains, right, as it relates to having coverage options and Medi-Cal, which we call Medicaid here in our state, available to individuals, regardless of their status, immigration status, up to the age of 23. And then most recently, this past legislative cycle, we expanded it to folks that are 50 plus. So obviously, we still have that gap right in the middle. And so we continue to work on that expansion in the state. But again, I think that what the pandemic has really demonstrated to us is that we need additional access points. Our health workforce is in dire straits right now. And so we really also need that culturally competent provider that speaks the language of the individual, because we know that if someone is speaking to a physician or a clinician that understands what they're saying, right, naturally they will have better health outcomes. And so we continue to push for that as well. But as it relates specifically to Latinas, of course, we want them to continue to have access to the vital primary care services that they need. An additional point is that we are already starting to see how Latinas have not accessed vital prenatal care, for example, right? And it's easy to see how how that will impact our population going forward. So lots of losses, but of course the advocates here on this panel together, we continue to push to ensure that access for Latinas continues to expand across the country.
Thank you, Bernice. Ymelsi, the next question I'll direct to you. Are Medicaid and Medicaid expansion efforts closing disparity gaps between Latina and other communities? And are these efforts helping to provide additional access to healthcare services for Latinos?
Thank you for bringing up this important question about Medicaid. So I think let's just be grounded in the fact that Latinos are still the group with the highest uninsurance rate in the United States. And this is especially problematic because according to the US Department of Health and Human Services, Hispanics are more likely to suffer from HIV, from cervical cancer, for example, than non-white Hispanics. We know that the Census Bureau said this year that Hispanics are still the highest group of uninsured people in all 50 states and the District of Columbia. 50% of Hispanics have private insurance versus 75% of non-Hispanic white people. For Medicaid or other public health insurance, Hispanics have around the same rates as white people, and that's about 36% versus 34%. The lack of Medicaid coverage impacts access to sexual and reproductive health care, often putting that essential health care out of reach for more than 800,000 women of reproductive age. So it's really important, as my colleagues have said, that Medicaid coverage is one of the most important ways for women and Latinas to be able to access sexual and reproductive health care. Medicaid helps people access essential preventative programs and primary care. They cover birth control, testing and treatment for sexually transmitted infections, and pre and postnatal care. We already know that Medicaid, it's already the largest payer of reproductive health care in the nation. About 1 in 5 women of reproductive age currently have Medicaid coverage, and Medicaid also covers more women's health services than any other type of health insurance in this country. Even with those stats, almost 1 in every 5 Latinos does not have any coverage at all. And this varies widely among subgroups. So we know that in the United States, Puerto Ricans and Cubans are more likely than Mexican Americans, for example, and other people from Central America to have coverage of any kind. There are several reasons for this, and my colleagues already alluded to some of them, like the language and the cultural barrier and the lack of access for preventative healthcare services for Latinos, as well as the immigration status affect the type, the frequency, and the quality of care Latinos receive in this country. So besides those inequities and the cultural and language barriers to access healthcare, politicians in certain states, like my state of Missouri, are making it harder for Latinos, for Black people, and for low-income people to access healthcare. This inequities does not exist in a vacuum. We know that inequities are linked to limited resources, money, transportation, time to see a provider, as well as a lack of health insurance and a shortage of healthcare providers in underserved areas. And the cultural and language barriers are keeping Latinos and Black people from getting the care that they need. I think to end your question, I want to lift up that it's important to recognize our nation's history with white supremacy, structural racism, discriminatory treatment, and experiences of bias and medical abuse also lead to Latino people in the United States to report lower level of trust in doctors and in the healthcare system as a whole when compared to their white counterparts.
Thank you, Ymelsi. Lillian, this question is for you. Uninsured Latinas face additional barriers when it comes to accessing healthcare options. What are the corrective measures, political, procedural, or policy-based, that we should be focusing on now that will remove those obvious barriers?
Thank you, Janet. That's a tough question, but it's one that I do give a lot of thought to on a fairly regular basis. I would point to the issue of maternal health, maternal death, maternal morbidity. Most people don't realize that Latinas are 3 to 5 times more likely to die during childbirth, something that we sort of take for granted. You get pregnant, you have a fairly difficult pregnancy, you have a run-of-the-mill pregnancy, but we expect you to come out of this with a baby. But they are 3 to 5 times more likely to die during delivery or shortly after delivery than white women. And African American women have similar, if not higher, stats than that. And Farron was very instrumental in helping to pass a law in 2018 called the End Maternal Deaths Act. We didn't do that as a company, and we don't really have a fight in that space. We do have drugs that induce labor, but they're mostly used in Europe. But we had a heart for this issue because we knew that it wasn't really being addressed. And you say, well, why is it we're just now talking about this issue? Why is it? And you're seeing it in the news all the time now, but you weren't 5 or 6 years ago, 10 years ago. So I discovered that between 2007 and 2017, the National Center for Health Statistics froze reporting on maternal health. And so I envision, because I always go to, well, why did this happen? So I envision a room full of white males sitting around the table, deciding how to use the limited funds that they had. And there was nobody who looked like us in that room, right? And they say, if you're not at the table, you're probably on the menu. And we were on the menu in that case because we were cut. So for 9 to 10 years, nobody was even reporting. And actually, states don't even have the obligation to report now because of the law that was passed in 2018 in Maternal Deaths Act, which was sponsored by Representative Herrera Butler from a Republican from Washington State, and certainly, enjoyed bipartisan support. I think every Democrat supported that bill into law, but the Republicans were in the majority at that time. So that will compel states to actually report on why a woman died during delivery. During the hearing, we were able to highlight the severe racial bias that Ymelsi pointed out. You think a woman has a relationship with her doctor, she's been seeing him throughout her pregnancy, whether she has fantastic health insurance or she's on, public assistance, the doctor, it doesn't matter. He's her doctor, he's her friend, right? Well, it turns out we discovered during testimony at the hearing on the End Maternal Deaths Act that doctors are not listening to Latina and Black patients. Representative Herrera Butler actually testified that she almost died due to hemorrhaging. An Afro-Cuban, the widow of an Afro-Cuban woman was testifying that he and his wife discovered that there was blood. They saw blood through a tube and they pointed this out, and the nurse said, "Oh no, that's not blood." And she died. She died on the table. Thank God her son, survived, but she's gone. And Serena Williams, the pro tennis player, she's talking today about racial bias and how it almost led to her death after childbirth. So clearly this isn't an issue of, wealth versus lack of wealth, education versus lack of education. This is across the board. We've got to get doctors and healthcare professionals to listen to us, to whatever the language barrier is, if there is a language barrier, and mostly there isn't. So this is an issue that I work on and that my company is focused on, changing the way women are, perceived during that very, very important, procedure. And there's so many others. You could look at almost any morbidity around the country and say Latina and Black women are disproportionately dying and suffering So I would say in this case, policy lawmakers have to be, more involved. And I'm so proud that they are now in the states at the federal level. But just look at that 9-year gap where that, nobody thinks about the National Center for Health Statistics. It's clearly very important, and we have to be at the table.
Thank you. And Deborah, this is an issue that's near and dear to my heart. Well, really, all of these issues are. I've been personally affected by them, but I suffer from autoimmune conditions. Your work as a rheumatologist and medical director of Exogen, how would you describe the impact of lupus on the Latino community? And how is the current healthcare system in the U.S. helping or hurting Latinos suffering with lupus?
Latinas and women of color of autoimmune disease, it is huge. We know it affects more, and as I described before, more severe consequences. Childbearing issues come to the forefront too, as many of the other panelists have described, due to the autoimmune disease. And the other thing that I think is huge is that a lot of physicians, and I've had this happen to me too, don't listen to young women. The beginning symptoms of autoimmune disease are often quite easy to confuse between many different diseases. And, there's often people will say, well, it's all in your head. You're not really experiencing this, when of course they are. They are truly experiencing it. And that's why we're so passionate about trying to get something out there that will help the doc realize that this woman really knows that there's something wrong, why she can't take care of her kids, why she can't get to work. COVID has just made this hugely more difficult for folks to be heard. And I think that's also why, so it's young women as well as women of color. One of the things that we've actually put on our website to try to help folks that think they might have a disease, an autoimmune disease, and specifically if they're thinking about lupus, we've put a little questionnaire that the patient can go and fill out, and you can it reviews different types of symptoms that one has, and you can collect your thoughts and say, okay, how often have I had this? And then you can print out a copy and take it with you to your physician to help wake folks up and to give a really nice, concise description of what they've been experiencing. And we're hoping that this will be of benefit to women as they go in and talk with their physicians. We have to be our best advocates ourselves. We have to advocate for ourselves as well as women. And especially in the cases where diseases affect through genetics, environment, everything else, women, we have to empower each other.
So it seems like a lot of the focus of our conversation today has been on the quality of communication between Latinas and the healthcare community. Often, Latinas and other women of color seem unheard. So this is a question I'll pose to each of you, is what recommendations do you have for women that will help them to develop and maintain healthy relationship with their doctors, especially as it pertains to quality communication of their health issues and concerns? And Ymelsi, we'll start with you.
Sure, thank you for that question. And as a healthcare provider, Planned Parenthood knows firsthand that a good doctor-patient relationship begins with trust, as we mentioned earlier. So we have to acknowledge that systemic racism within the healthcare system specifically has dismantled this trust, and it has dismantled it specifically for Latino communities around our country. So I want to reframe your question, because I don't think the question should be, what do patients need to do to improve their relationships? I think that rather it is incumbent upon all of us as healthcare providers in this country, as advocates and policymakers, really to contemplate the many ways we need to reestablish that trust, that cultural competency, and that patient-centered decision-making, that it's really going to lead to the dismantling of oppression and oppressive systems that have enabled all of this misinformation and mistrust in exam rooms around our country.
And Lillian, I'll take that question to you now.
So, I absolutely agree, Ymelsi. And I would say, we all have a responsibility, to ourselves to be open and honest with our physicians, with our healthcare providers. It's not always that easy. When I moved back to Houston after being gone for 30 years, living on the East Coast, Janet and I are from the same hometown, and things are very different. When I got back here, I realized I gotta get my Rosetta Stone out. I minored in Spanish. My maternal grandmother is a Mexican immigrant. We were taught not to speak the language, as many of you probably have heard 30, 40 years ago, and now we need the language. I said, there's no way that I'm going to be able to operate in my hometown if I can't speak the language. And I think that physicians, I think it's incumbent upon them to realize that, whatever the language is. If you're with a Black patient who is from the South, and you went to medical school at Harvard, it's incumbent upon you to learn the language, the lingo. If you're in Houston, if you're in San Antonio, if you're in Oakland, California, and the majority of your patients speak Spanish as a first language, it's kind of incumbent upon you. If you're going to treat them, you got to treat the whole person. Several years ago, the American Medical Association came out with an apology for excluding Black doctors from the organization. And I think it was the American Psychiatric Association that just came out and apologized for not including racial bias and racism in their entire thinking. I think organizations have to do that. ACOG, the American College of Oncology and Obstetrics, they are working on something like that for their patients, and I only know that because I work in maternal health. But I think the word has to get out that you have to treat your whole patient. The world is as it is, and you've got to see it that way, and you have a responsibility as well. We know what our responsibility is, but doctors who really want to treat the patient, you got to be able to talk to us.
And Bernice, what are your thoughts?
So first, I like that idea of, treating the whole patient. And to me, that translates, and I think to many of us, as the social determinants of health, right? And so we as organizations, as large systems that have, like community clinics have been out there for, 50 plus years. Ultimate has been in the community for almost 53 years, right? So we come from the social justice movement, and so we have that deep-rooted trust. And I think organizations like us that primarily serve Medicaid patients and are the safety net, and we also serve about over 85% Latinos, right? So it's really kind of at every box that we're checking on that. We also have the responsibility to respond to community in a way that meets their needs, right? And so that could be something related to connecting them with a resource as it relates to housing, potentially something around food insecurity and connecting them with those resources. This became vitally important throughout the pandemic. Of course, a lot of us had to pivot very quickly and begin to offer services to community that typically are not the core of what we do. But as systems, I really do think it is our responsibility to step forward. In that spirit of stepping forward, right, there's the accountability as well to our elected officials. And so we need to, because we can create the spaces and places where these conversations, exchanges can be had, it's important to represent the needs of the community. And by default, again, staying connected to the needs of the community. We can take that top-down approach, right? But there's nothing like really having a patient or somebody from the community next to us when we're making that pitch. And then finally, I do think that there is something that we can do as patients and making sure that we're receiving the primary care services that a lot of us have put off during the pandemic, right? Prevention is key. So getting your cervical cancer screenings, your mammograms, et cetera, all that preventive care, right? And really advocating for ourselves so that we can make sure that as Latinas, as breadwinners, as participants in the health workforce, we are healthy and able to take care of ourselves and others.
And Dr. Zack, very quickly before we move on to audience questions, what are your thoughts?
Well, the exciting part to me, when I went to medical school some years ago now, I won't tell you how long, But I was one of 25 women in a group of 200 students, most of which are were male, and there were very few women of color and Latinas or Latinos within my graduating class. I've seen that completely change in rheumatology. Women are now over half of practicing rheumatologists, and we've got folks from every ethnicity now. When I go back to the College of Rheumatology meetings, I'm just thrilled with the diversity that is now being trained. So I think there's hope for the future. We just have to hang on.
Terrific. Thank you so much. So we'll be moving on now to audience Q&A. And the first question from our audience that I'll direct to Ymelsi. Ymelsi, who should women contact if they're not being treated equitably by their doctor or healthcare provider?
I love that question, right? And I think what you've heard today is that we need to become advocates of our own health. So certainly there's many ways you can do that, but one of the ways that we can be more proactive in ensuring health equity around our country, it's to contact your elected officials, right? And make sure that they're hearing from you directly about the policies and the impact on potential legislation on your well-being and on your health. And there's many ways to do that. You can certainly contact Planned Parenthood and your local Planned Parenthood office, and we can direct you specifically to get in touch with on how to get in touch with your local officials. But it all starts with advocacy. We need to work on empowering ourselves to make decisions and ensure that people are hearing directly from their constituents when things are not representative of the will of the people.
Thank you. And Lillian, this question is for you. What type of healthcare insurance coverage should Latinas expect from their employers? And what should we actually be negotiating from our employers?
Great question for me, because I also, in addition to working in maternal health, I work in infertility treatment. My company is one of the largest manufacturers of fertility drugs. We actually help people have babies. And we started a coalition about 6 years ago with patient groups and providers because we discovered that, in 39 states, there is absolutely no requirement of health insurance for infertility. And while I think everybody in this audience recognizes the disease of infertility, I think that many, many people still believe that it is a rich white woman's disease. You see me, I am clearly Black. As I said, my maternal grandmother is Mexican American. So I'm not white, and trust me, I'm not rich. Look around me, I'm not rich. But I was a patient. I was an infertility patient many, many years ago, and I was not married. I was engaged. I had good health insurance. I had Blue Cross Blue Shield through the federal government. I was a federal employee, and it didn't cover me. And, try as I did to come up with the money, I wasn't successful to be able to cover IVF, which is very expensive. And I say very expensive, it's no more expensive than other treatments. It's just that other treatments are provided for. So in talking to lawmakers over the last 6 years, I'm talking Latinas, I'm talking Black, lawmakers, they all look at me with this, like glazed over look, like, is this issue important to my constituents? And I'm like, guess what? Latinas and African American women are 2 to 4 times more likely to be infertile than white women. Let that settle. Absolutely. Even shocked me, because I was one of those women who was in the closet, like most of us are, because we're told in Latina families, in Hispanic families, in Black families, your grandmother had 15 kids, your mother had 5 kids, you can have a baby. So we just went into the closet. I think we're coming out, but that is one issue where we're talking about people who actually have insurance. And I would say that education is my biggest challenge, educating lawmakers who look like me to understand that this is important to us, that it impacts us. And I can imagine that if it's infertility, it's something else as well that you don't think really, really impacts us. I think we have to go beyond those bread and butter issues of labor and education, that we've always traditionally advocated for. We have to go, I think, especially healthcare. I think healthcare is today's civil rights, and that's how we have to treat it. So I would say that, we have to be more open and honest, but our lawmakers have to be more responsive. And as far as employers, I have to give kudos to a lot of the bigger, especially the tech companies. They are recognizing that many women, especially Latinas and Black women who traditionally got married right out of college or before college, right out of high school, they are putting off, having a family. And so they're tending to be, older when they're trying to start a family. And so many of those companies, but again, in 39 states, that is not a requirement, and it just doesn't happen. Our federal workforce is not covered. Our military vets are not covered. Our military troops do not have coverage. So I would say that, advocating for yourself, you can actually go to your employer. I only know this because I did. But again, we're not a community that, historically feels comfortable standing out and going to an employer asking for something that may just be for us, So I think, like Ymelsi says, we have to be more proactive in our communities. And, we've gained a lot of strides. The Latina community, the Hispanic community, the Black community, we've gained so many strides, but we have so far to go. And I think that, we really have to be more proactive in our self-advocacy and our advocacy for our community.
Thank you. The next question I'll direct to Bernice. Bernice, how can the private and public sector promote the well-being of Latina health? What are some examples of what is being done now?
Sure. I think that one of the main things is that recognizing that Latinos are not a monolith, right? That we have the same issues that we're dealing with as everyone else. So not really kind of putting us in that box, right? It limits things like, as Lillian was mentioning, it related to infertility benefits, but also really, I think, kind of it creates an inability for people to feel like as if they, they're going to be heard, right? Someone who already is approaching someone, a system entity, that's already intimidating enough, right? So I do think that we need to do more as it relates to developing advocates in our communities, civically engaging our communities as systems. We do that here at Ultimate. In fact, I lead a program called My Vote, My Health, and really making that link, right, where we're going out to the community. We have a program, we're developing advocates, we kind of walk them through developing their story, et cetera. And then we create the space for them to come and join us in conversations as it relates to advocacy. That part of it, I think, it's easy for us to say, go talk to your elected official, but then how they do that can be pretty intimidating. There is a place for us to be able to step forward in that space. And again, just that awareness by systems and in the private sector, what the needs of their employees actually are, right? And being open to that. And then by default, helping to put pressure on those elected officials to create the programs and pieces of legislation, like the one that we have right now, the Build Back Better Act, right? We had a lot of negotiation go back and forth, and that paid family medical leave was initially there, then it went away. And now, thankfully, at least we have 4 weeks in that piece of legislation, and that needs to stay there. Just given all of the gains, all of the losses that we've sustained as Latinas in the workforce, the fact that we took the hit with childcare, we need to have those types of benefits. I think it is the responsibility of not only government but systems to protect Latina workers and give them the services that they need and the coverages in order for them to be able to contribute to our nation's economy.
Thank you. Dr. Zack, the next question is for you. And it's a question that's in a lot of our minds. How do we encourage more Latina women to go into STEM professions, particularly healthcare?
Oh, that's a great one, because we certainly would love it. And it often starts very early. So I think just the awareness that women are perfectly fine at science and math. We're often told we're not, but we are. And when young ladies, young kids in school have those talents, by all means, just encourage them, make them see that there's so many things that they can do with that. And there's often programs in the public high schools and programs in public schools around the country. I know there certainly was in LA where my kids went, that encourage folks with those interests and girls with those interests to apply and get accepted into some specialized programs. We need that group coming through for all of us and for our country.
Thank you. And Ymelsi, this final question is for you. And the question is, how has the unemployment rate due to the COVID-19 pandemic affected Latina health? And we all know it has in many ways. It's a difficult question.
Yeah, I think that the COVID-19 pandemic has had a rippling and devastating effect in all aspects of human life, specifically as it relates to Latinas. When we're seeing, right, the disproportionate burden that Latina women carry as just the breadwinners, the raising of the kids, the educators in the family. And I want to just go back to the point that Bernice made earlier about how important it is for us to ensure that our lawmakers and our politicians are taking care of the people, in this case, the women that take care of this country. So it is critical to ensure that paid parental leave becomes the law in this country. We all deserve that as women. And the other thing that I want to touch on that I don't think we got an opportunity to talk about, it's like, to your point, Berenice, Latinos are not a monolith, right? And we want and deserve the same things that all people in this country want. We want access to healthcare. We want access to good jobs. We want access to education. And I think that we also shouldn't miss this opportunity to think about the huge disparities that our undocumented brothers and sisters face in this country, right? When we think about employer-sponsored insurance, a lot of them don't have access to that. When we think and advocate for Medicaid expansion and what progressive policies we have seen in other states that we can adopt here, I think California, right? It's a great example of how progressive policies can really improve health outcomes for all people. And they have not only expanded Medicaid, but they have even expanded that to include the undocumented community. And I think that is a human right that we all deserve, right? If we're thinking about social determinants of health. And the other thing that we should think about, and I want to give kudos to the Biden administration for ensuring that we were lifting the gag rule on the only federal program that covers undocumented individuals and low-income people access to preventative reproductive health services like Berenice talked about, right? Those cancer screenings, those birth control needs that allow us to live freely and thrive and pursue our education and go into the sciences. So I can't stress enough, and I would be remiss to leave our conversation today without ensuring that we are empowering Latinas. Use the power of your vote. And for those of us that have the opportunity and the honor to participate in civic engagement, let's make sure that we're also centering our votes and our advocacy for those Latinos in this country that unfortunately don't have the opportunity because of their documentation status in this country to actively participate and advocate for better policies.
Thank you, Ymelsi. So our time is winding down today, and I'd like to invite all of our distinguished panelists to give us their final thoughts on these issues. Lillian, we'll start with you.
Thank you, Janet. And I'm just, again, so honored to be a part of this panel. I would say that the fact that hundreds of people actually tuned in, that you took time out of your very busy day to do this. This is not what you do for a living. You want to learn how to help Latinas thrive and grow in this country and get better access to healthcare. So I just say hats off to you, because You're the army that we're counting on, and we are just all so grateful to be able to have this discussion with you. And I look forward to the time when we can all be together and have this conversation so that we can get rowdy with each other and, high five. And I high five. I am so, so honored. You cannot imagine how honored I am to be with this esteemed panel. And to CHCI, there are a lot of organizations who are doing panels, but you are top notch, absolutely top notch. And please keep doing what you're doing. I have always been a fan, and you're just the bomb. So thank you so much.
Thank you. Dr. Zack, your final thoughts?
I want to echo that. Thank you so much, CHCI, for putting this wonderful panel together. I've really enjoyed talking with you lovely ladies, and I feel honored as well to be a participant in this. My final thoughts are really, we've got to improve access. We've got to get earlier diagnoses. Earlier diagnoses or better outcomes. It'll stretch our healthcare dollars, make them more efficient. It's not like we can divide the pie even further as we grow it. If we better utilize each of our healthcare dollars so that we can take care of all the folks that we need to. There are new diagnostic tools, there's new medications coming out every day, but you have to start with getting identified with what you've got. And these diseases don't affect just one person, it affects the whole family, the whole community. But there's hope, especially when all of us work together on these things. And it really encourages me to hear all of your words today. Thank you so much.
Thank you. Ymelsi, your final thoughts?
I just want to echo what my colleagues have said. It has been such an honor and a great opportunity and a unique opportunity really to lift up the state of Latino health in this country. I am grateful for all of you who have joined this panel discussion today. I hope that it was informative, and I hope that you leave this session today knowing that you've heard a lot of opportunities on what we can do to close the gap on the healthcare disparities among Latinas, especially under an administration that is committed to protecting and expanding access to reproductive healthcare and healthcare in general. And I would be remiss, like the advocate in me can leave this forum today without urging you to remember that in the states where healthcare policies are often governed under much different political realities than California, for example, providers continue to face enormous challenges due to unnecessary medical restrictions. So we need to continue to push back and press forward. The time it's of the essence, so we need to continue to work together to swiftly pass greater protections for the most marginalized communities and find really solutions that take into considerations those real world environments for the people that we serve. So thank you for the opportunity. Pa'lante siempre.
Thank you. And Bernice, your final thoughts very quickly.
I think what I want to say is that representation matters, right? We're able to have this conversation because each of us uniquely brings our perspectives and lived experiences to the table in all of the places and spaces that we have the privilege to be in. I think that that's number one. So for those of you Latinas and Latinos watching us today, continue the hard work to join us at this table. And then second, I think that I just want to take a moment to thank CHCI, as a proud alum of the program in 2011, class of 2011, CHCI really did change my life and trajectory of my career. So I'm eternally grateful. I agree, Lillian, they are awesome. And I'm just really privileged to be a product of the program. And so thank you very much for having us today.
Thank you, Bernice. And thank you to everyone who logged in today to hear our panel discussion on the future of Latina health. On behalf of the CHCI, I'm Janet Alvarez. Thank you for joining us today.